Hi, and welcome to the final session of Deviation from Ideal Mental Health, where we'll take a look back over the definition and assess your learning. And this makes use of retrieval practice, which is a really valuable part of revision, since you want to focus on bringing information out of your memory rather than just keep reading and keep using the flashcards to keep taking information in. So to begin with, read the overview on the screen, and this covers ideal mental health, and see if you can fill in the gaps from memory, and pause the video for 10 minutes while you do so, and do try to do it from memory to really push the boundaries of what you can recall. Hopefully you got some of them, but the answers are on the screen for you to mark yourself against. So Jahoda, 1958, took a different approach to defining abnormality, suggesting that abnormal behaviour should be defined by the presence of particular ideal characteristics. In other words, behaviours which move away or deviate from ideal mental health. She proposed 6 principles of ideal mental health: having a positive view of yourself, high self-esteem with a strong sense of identity, being capable of personal growth and self-actualization, being independent of others, autonomy and self-regulating, having an accurate view of reality, being able to integrate and resist stress, being able to master your environment, your love, your friendships, work and leisure time. Therefore, if an individual does not demonstrate one of the criteria, they will be classified as abnormal according to this definition. Now, this next task is going to assess your learning of ideal mental health and other topics which you may have studied online recently. So the questions in the grid are weighted with marks based on where the topic appeared in this series of Tutor to You online videos for definitions of abnormality. So ideal mental health questions are worth 1 mark because they're the most recent and technically should be the easiest to answer. And statistical and frequency will be worth 3 marks since that was our first online session, and therefore the recall for that will be a little bit tougher. So your task is to answer as many of these questions as possible within 5 minutes and achieve the highest score you can starting now. So pause your video for 5 minutes and answer as many as you can, but time yourself. So we can have a quick look through them now, and you can award your own marks, and then you can always compare your final score to your friends or your classmates. So what is a social norm? So we're looking for something along the lines of it's an implicit rule in society that tells us what is and is not acceptable in behaviour. Number 2, what do normal distributions look like? So for 3 marks, we need to be mentioning the bell-shaped curve, the tails at either end, and the symmetry between both sides. What is meant by environmental mastery? So the ability to adapt to change. Why is statistical and frequency objective? So your answer wanted to revolve around the fact that it takes a mathematical approach to define an abnormality, and it uses quantitative methods rather than subjective opinion and perceptions. Why does culture matter? Well, because cultures have their own norms and traditions and beliefs about behaviour and normality. Why does time matter in social norms? So if you remember from previous lessons, time can really change our perception of behaviour. For example, attitudes towards homosexuality changed. How can the 6 criteria be used to help people? Well, we can spot what someone might be struggling with and offer some intervention, for example, with self-actualization. Distinguish between implicit and explicit rules. So implicit rules, as we mentioned earlier, there are unwritten rules from society about what is acceptable behaviour, whereas explicit rules, there are rules that we have to stick to. So for example, the law. And why does desirability matter? So this was a reference to statistical infrequency, and it matters because some behaviours that are rare and statistically infrequent are still desirable, and the query is, does this make them abnormal? We can have a look now at the next task. So on the screen, there's 8 statements about ideal mental health, and your job now is to decide which ones are true and which ones are false. So pause the video for 10 minutes while you have a read. Now it's really important not just to pick true or false, because really that's just 50-50. Try and justify your choice. So if you think something is true, be convincing about why it's true. And if you think something's false, then be able to justify your decision. So pause the video now and complete the task. Ideal mental health criteria is objective. This was false. Really, to be objective, we need some type of quantifiable way of looking at behaviour, and this doesn't include that. Number 2, ideal mental health has no positive implications. And this was false, as we've just said. It can actually be useful in spotting what somebody needs help with. 3, ideal mental health can help us understand where mental health originates from. And this is false as well. Ideal mental health is culturally biased in defining abnormality. True, and we've spoken quite a bit about that one. Ideal mental health is more scientifically credible than statistical infrequency, and that is false. Ideal mental health is not achievable for all, and that is true. Ideal mental health requires all 6 criteria to be achieved. True. Ideal mental health requires people to follow social norms of behaviour, and hopefully you spotted that that was false. And that's more in line with our deviation from social norms definition of abnormality.